NP diploma mills. Are we diluting the profession? Welcome back, everyone. Another installment of my Coffee Talk vlog series where I talk and I drink coffee. Today's Coffee Talk is a response video. A little different here. I'm gonna, instead of being a live video recording, this will be pre-recorded. Still gonna be a one-take vlog. Just want to get all my thoughts out there before I release this to the masses, because this is a sensitive subject. I'm doing a response video in response to an article that was posted on Kevin MD titled, and I have it pulled up so that I don't get all my facts straight. Independent practice. Both nurse practitioners and physicians should be outraged. If that isn't shock journalism, I don't know what is. Talk about grabbing your attention. It's an article that's written by a physician that, before I even dive into it, I feel is probably a bit one-sided, which is evidenced by this particular physician closes out the article by promoting a organization or a group that they are a member of. We'll get to that in a minute. They promote or encourage other physicians to become a part of this particular group, and this is geared towards physicians, although those who have read articles over on Kevin MD before, I think he does a fairly good job of promoting and what's the word I want to use? Advocating for pretty much every profession, so it's not just for physicians. We'll start with that. The article goes in to talk about NP diploma mills, and they describe NP diploma mills as those direct entry kind of programs that promote a 100% acceptance rate. And the art, and I'm quoting this right from the article. It's referring to direct DNP programs, which many boast a 100% acceptance rate. Also talking about the 15-month MSN to DNP programs, bridge programs where nurses can, work at the bedside or continue working while they're gaining their advanced practice education. Also, other accelerated programs, including this is their words, not mine. There are multiple accelerated programs that allow students who have not worked 1 hour as a nurse to become an NP. Even direct entry programs that allow students with a non-nursing bachelor's degree to become an RN and an NP seamlessly. This is a very sensitive subject, and it's a popular subject these days because I've been contacted a couple times through my Hey Sean video series, as well as on the Fresh NP website, and I briefly have discussed it. I did a quick response video a while back, I think, for Fresh NP, and it talked about the purely 100% online programs. And my opinion of the 100% online programs has changed a bit. I've flirted across the decision line a couple times. Am I for it, against it, for it, against it? The more and more that it comes to light, the more and more I'm hesitant about these programs. Am I completely against it? No, I'm not completely against it, but I'm hesitant. The 100% online programs versus the traditional brick and mortar physical programs. Is there a big difference? I don't know. I've commented on it before that I think you're missing something by doing purely online. Are you getting the same education, the same curriculum? You sure are. I mean, there's standardized, there's a standardized educational program or curriculum that meets national standards. I mean, that goes without saying that they have to meet national standards, whether it be through, I don't know what the governing bodies are. Sadly, I don't know that. But I'm pretty sure it has a lot to do with certifications. You cannot sit for the certification exam if you have not met the requirements. And certification exams from AANP to the ANCC. There's other certifying bodies out there, but those are the two big popular ones. You can't sit for either one of those exams without meeting the minimum educational requirements. We're just gonna randomly start on some topics that I gotta get off my chest. Sorry, gang. Let's start with the 100% acceptance rate. I don't know about you, but this might be this might water things down a bit. So if it's a 100% acceptance rate, then where's the competitive nature of the program? Let's take for CRNA schools, for example. Getting into CRNA school is competitive, really competitive. You not only have to have almost perfect grades, but you're going to have references. You're going to have a good interviewing process. There's a rigorous process that you're going to have to go through in order to be accepted into that particular CRNA program. And these programs that tout 100% acceptance rate. So then where is the quality of the applicants? Now remember, I'm an NP, so I'm trying to look at this from both sides. Sure, I get it. I know that life is difficult. We got to pay the bills. Most NPs are going back to school a second or third time. They have families, they have mortgages, they're trying to balance work life, trying to go back to school to advance their education. But we got to draw the line somewhere, I think. I think maybe a 100. So let's look at it this way. Here's a good example. Getting into an RN program, a BSN program, there's a waiting list, and it's competitive. Your application can be declined. They can say you're not an ideal candidate. And I would think that we should do that for NPs, for these advanced practice roles. If you are entering a part of the profession, an advanced practice role, where you're going to be prescribing medications, you're going to be a licensed provider, and you have the theoretical potential to practice independently after a certain number of years, depending on which state you're in and the requirements, and we'll go into that in a second. Yeah, I think there should be some guideline. There has to be a stringent entrance guidelines. I'm going to keep using guidelines. I don't believe in the 100% acceptance rate, because then, any Joe Schmo off the street who meets the bare minimum requirements and doesn't, I don't agree with it. I don't agree with 100% acceptance rate. Now, this could be completely wrong. I'm basing this solely off of the article that I read. Are there programs out there with 100% acceptance rate? I have no idea, gang. I'd have to go look that one up. So, That's my first thought, that I do not agree with 100% acceptance rates if they truly are out there. I got a list, so we're going to go by my list. The second one is 0 working hours as an RN. This one has the potential of being correct. From the article, it says, accelerated programs that allow students who have not worked 1 hour as a nurse to become an NP, and specifically talking about direct entry programs. This is theoretically possible. Let's go to the extreme example. You have a high school student who gets into a BSN program right out of high school, 18 years of age, starting the nursing educational career journey. They finish their BSN in, let's even say that they're super motivated. They could do it in 3.5 years, maybe even 3. I've heard of it. Don't know of anybody personally. We're going to go 4 years. In 4 years, they gain their bachelor's degree in nursing. They graduate in May. They apply for an NP program. They get into an NP program. And they start their NP program in the fall of that same year. So they've only had 4 years of college education experience, and their experience as a licensed nurse hasn't even started yet. They graduate from their BSN program, they take their boards, and they have successfully earned the license of RN. They are now a registered nurse. They could theoretically not work at all and continue going straight through a accelerated program. Once again, I am talking about extreme cases. And in this accelerated program, to go from BSN to MSN, you could theoretically, working full-time, I think you could get through it in 2 years. I have heard of instances where super motivated, crazy students taking like 18 credits, depending on how the program is structured, they could get it done in 1.5 years. They finish in the fall and they go through an accelerated like 16 months. 18 months, I think. So 1.5 years. In 1.5 years, maybe they're working part-time just to maintain their hours. Now, I don't know what specialty area, what specific clinical course, and what they want to become, whether they become an FNP or an ACNP, or if they work in psych or neonatal. All of that has to do with specific program requirements. But the bare minimum, they could go from a BSN to an MSN in 2 years. And in those 2 years, let's say they worked a per diem job and they worked twice a month. So twice a month they worked an 8-hour shift, so 16 hours in a month. And 18 months later, they've worked, 18 months, 160, man. So they haven't even clocked in 250 hours. I can't do the math in my head right now. I'm hypocaffeinated. If you do, we round it up to 10. Let's do the math in our head, gang, because, you know, nurses love math. So 18 months at 8 hours, 10 of those is 180 hours, and 8 hours is 8 times 64 hours. So 160 plus 6, 12, 13, 160. Yeah, they haven't even gotten through 250 hours of at the beds, or not even, doesn't even have to be at the bedside. So we're going to go the extreme case here. They work 8 hours in an office setting where they do intake forms, or they work in a cardiologist's office. I'm trying to think of a really extreme case here. They're not even in what we call inpatient direct patient care. They are seeing patients in an outpatient setting, an office setting. So they have worked less than 250 hours as an RN, a licensed RN. They graduate from their MSN program. They sit for their their nurse practitioner boards, because in many states, the minimum is to have a master's degree in a nurse practitioner program, which is what I have, what I started with, what I currently possess. They get their master's degree and they pass their boards. They are hired into a office setting of some sort. Now they have their MSN. They've worked 250 hours in an office, and now they are going to learn how to become a licensed provider in that particular state. And let's continue on the extreme case. 250 hours total patient care. They now have worked, they're now working as a nurse practitioner, and I don't know the details on specific state practice acts, but there are states out there that allow nurse practitioners to practice independently and to see patients without the oversight of a physician. They could, and let's just say they have to work a minimum of however many hours. And we're going to take that as 2 years of experience as an NP, because I don't remember how many hours it is. And with only that limited amount of experience, they are going to prescribe and treat patients as an independent provider. That scares me. And it should scare you, and it should scare every patient. That is unsafe. I am a nurse practitioner 5 years, and I think about what I didn't know in the first 2 years of my practice. What I didn't know, what I needed help with, how much hand-holding I needed when I started as a nurse practitioner from other NPs, other advanced practice providers, and especially my physician partners, those who I collaborated with. They had to hold my hand a lot. Food for thought. The non-nurse direct entry programs, I've never been a fan of those, because it once again stresses the concept of not having enough hours under your belt of direct patient care. That's the whole point of probably this entire video and that article, is not having enough training and experience to care for patients at that level. At that level. If you want to be an independent practicing provider, you should have thousands of hours of experience. Thousands of hours. Not a couple hundred, thousands. The next point I want to make is that they're talking about clinical hours, and many of it they use the honor system. I'm going to quickly try and find it if I can, without wasting everyone's time. Is that that's chronic? Yeah, I can't find it, sadly. Okay, so what this is talking about is when you go through the clinical hour requirement in your program, it's mostly done on the honor system. And what that means is you have to make the arrangements for your clinical rotation, which sucks. That's a whole nother conversation. You have to make the arrangements for your clinical site. You show up for your clinical site, and the quality of your rotation is dependent upon whomever your supervising preceptor is, whether that be an NP or a physician. There are many times where nurse practitioner students will get lost in the shuffle, and they quite honestly could scrape by and do little to nothing. They're literally just logging in hours instead of actually learning something. And I have seen this firsthand as a preceptor and as a NP student. You can get lost in the shuffle because you are part of a larger care team when you're doing your rotations, wherever you're doing them. If you do them in a larger hospital, there is a sea of residents and students that you're going to have to compete with. So you absolutely could get by with taking care of a singular patient for days and learn nothing and simply just log hours. Yet more potential for compromising patient safety. And the last thing we're going to talk about is the article talked about outcomes, how nurse practitioners and nurses in the nursing profession, we as nurse practitioners have always promoted that patient outcomes that NPs provide the same, relatively same level of care as physicians do because the outcomes are essentially the same. That whatever measurable outcome you're looking at, the outcome is almost the same whether an NP took care of you or a physician took care of you. And that has been the precipice for many of the independent practice promotions out there, that we are, the nurse practitioner field is promoting wants independent practice, is fighting for independent practice in many states because we provide the same amount of, we provide the similar type and level of care that a physician does because of these outcomes, these measured outcomes in previous studies, which is all fine and good. But nowadays, those studies were based on nurse practitioners that were trained in brick and mortar schools, like myself. Those outcomes were based on NPs providing care who were trained in the traditional brick and mortar, go to a school, in a classroom type of environment. Not these 100% online, 100% acceptance rate programs. Those NP diploma mills that this article is talking about. And I gotta say, that is one heck of an argument. That these outcomes were based on the actions of NPs who were trained in the brick and mortar school. Once again, the argument is that the brick and mortar school is producing the same quality of NPs that the online program is. That online programs produce the same quality education that brick and mortar schools do. And I don't know. I truly don't know. Probably because I have no experience with 100% online. And I wouldn't know if an NP did a 100% online program. This is a tough debate. I rest my laurels on previous and current experience. How many hours have you logged under your belt? Whether as a nurse or a nurse practitioner, how many hours of experience, direct patient care experience, do you have as a licensed professional? I have roughly 15 years. For 15 years, I've been caring for patients. I have a bit of experience. Unlike the current generation of NPs who are literally fresh out of high school, fresh out of grad school, so they have basically a high school graduation and then they've completed their advanced practice degree 6 years later. They have minimal life experience and they have almost minimal patient care experience. Now you could argue that in those 6 years you could gain at least 2 years of bedside experience, direct care. The experience you get as a student in your BSN program, that does not count. I'm sorry. That doesn't count because you're not practicing as a licensed professional. You're learning how to become a licensed professional, which is legitimate. But the clinical hours that you clock, those don't count. They do not count for when you're actually caring for patients as a licensed professional. And then you could make the argument that the clinical hours that you clock as an NP student, they also do not count as a advanced practice provider because you're still learning how to do the job. One could extend the argument and say that the first 6 months of your licensures, first 6 months as an RN or the first 6 months as an NP, those also don't count because you're under direct supervision, whether you're oriented by an NP and or RN or you're oriented by a physician. The first 3 to 6 months, you still have almost completely direct supervision. Now, we could once again argue that every program is different and every employment area, every employer is different. But that's the weakness of the argument, is that there are employers out there that do the bare minimum. There are employers out there, there are jobs out there. When you graduate, you're basically thrown to the wolves with no assistance. And we know how unsafe that is, yet it happens. I don't know about you, but physicians with their years of experience before they are a practicing provider, there's legitimacy to it. We as NPs are fast-tracking a lot of that education, and I think it has its merit and it's warranted because we enter the NP profession in a very different manner. But there's weaknesses to the equation. We all have to recognize that. Is it fair? No. Is it easy? No. But it's the truth. There are weaknesses to the equation. Some of the ones that I just spoke of, and there are others that we didn't even discuss because I'm trying not to bore you. I would love to hear what everyone else has to say on this particular topic. If you have made it this far, you gotta leave me a comment. And if you have made it this far, maybe, just maybe, you'll head on over to my Patreon page and maybe drop me some donations. I'd love to hear from you. You know how to find me. This has been another vlog series coffee talk where I talk and I drink coffee. And as always, check your own pulse first.